Hello everyone and welcome back. We're here live at day one of the AHIP Institute at Expo here at the Guidewell Connect Insights Lounge. My name is Kate Warnock and I'm so pleased to bring you our next guest, Mr. Ed Lehman. Ed, welcome.
Thank you very much. Nice to be here, Kate.
We're happy to have you. So, Ed, you are Senior Vice President at GrandRounds. Let's just start with what is GrandRounds? What's the mission of your company?
Yeah, our mission is to make healthcare terrific for everybody, no matter where they live in the country, and to do it in a way that proves that it will help their education status, their understanding of their disease, and their outcomes. So we're all about patient-centered everything.
That's a magnificent mission. So, all right. So I know that you're also going to be speaking here on a panel.
That's right.
Why don't you tell us a little bit about this race to re-engineer care delivery? What are some of the top points you'll make?
Yeah, I think we'll be talking later today, and we're very excited about that. We've got a good partner in Iora who I'm going to be presenting with.
Fantastic.
And we're doing three things that I think we'll talk about that are the most disruptive. The first is we've cracked the code on physician quality. So we can tell you for the first time in American medicine, in the history of American medicine, which doctor is exactly right for your specific condition. So not just the general, these guys are great orthopedics, but this guy is a really terrific orthopedic surgeon who does wrists. And we do that in a way that's very data-driven, so we'll be talking about that a bit. We also take care of everything before, during, and after the visit. So we get you either virtually to one of our experts or to an in-person doctor who's in your insurance network. We do all the legwork ahead of time, collect the medical records, get you ready for the visit. Afterwards, we follow up. In between then, we also get the doctor who we're sending to you ready. We either prepare a summary of the case so that they can review it remotely very quickly, or if we're going in person, we send the medical record ahead and we have them all set up, because healthcare happens between the doctor and the patient, right, usually when they're sitting face to face.
So it sounds like this is really a one-to-one solution that you have built that's high touch, high tech, and you're really kind of building in efficiencies in this care delivery system, isn't it?
That's exactly right. And we're removing the barriers for care too, the geographic barriers in particular. So it doesn't matter if you live in a rural area of the country or in a giant city where you have terrific health care. With the expert medical panel that we've built for our expert opinion product, we can get you to the best minds in American medicine. Your entire case can be reviewed by the person who does this every day and wrote the book on it, and then get you on the path with a local physician who can guide.
Okay, so here I am, a health plan executive, and I'm very interested in GrandRounds, but obviously I have a network that's built around my standards, my quality controls, my geographic footprint. How does this work with the offering that you provide?
Yeah, so for the expert medical opinion, that doesn't matter at all. We've directly contracted with our own network of about 1,800 expert physicians across the country, and we take care of everything there. It's usually paid for through the employee benefits plan at an employer. Okay. And for our in-person program, we are only sending to inpatient doctors, or to in-network doctors. And so we're not trying to be disruptive to the health plans in that regard. What we're trying to do is make sure that we're sending the exact right patients to the highest quality doctors who are already in networks for all of our employers.
Terrific. All right, well, and I know that you probably are very familiar with the stories about physician burnout.
Yeah.
Right? Where we have physicians who are trying to provide the care that they went to medical school for. And as you said, you're going to be talking today on a panel with Iora Health, who is really leading this transformation of care delivery. Do you think that more physicians are going to seek this kind of digital arrangement that GrandRounds offers?
I do, and we're actually seeing it already. So we have two types of physicians that we interact with. The first is those experts that I talked about. And we often get a question from our employers in sales meetings: why in the world would Dr. X and so, who's the head of a department and wrote the book on a certain procedure, why would he take the time to review a GrandRounds patient case? And what we're doing is giving them the patients that they've trained for. They may not be able to see them because of the geography, and we're putting them together. We had one expert who said, seeing GrandRounds patients is like seeing a patient that my best resident put the case together for. Wow. So they only see the people who are exactly right for what they've trained and what they love to do. And then our staff physicians, a big critical component of our model at GrandRounds is the physicians that we employ as staff at GrandRounds. And those folks don't have the administrative burden that a private practitioner does. Those folks get to interact with patients directly in a way that suits them. They get to follow them for a very long time. There's no time clock. And they get to just, talk and help and get people to a place where they understand what's going on and they're able to take action on it.
Well, I mean, that sounds like one heck of a solution, and obviously as far as providing what that physician really is seeking. It seems like you're seamlessly providing that kind of flow.
We are.
That's exciting. One more question for you.
Sure.
So here we are, GrandRounds, and you've been in business how long?
About 5 years.
5 years. How do you see GrandRounds iterating in this space? What more do you expect it will bring to the market?
Yeah, it's one of the great things about being based in San Francisco and having a team of really patient-centered folks, doctors, clinicians, care coordinators, all those folks who are listening to our patients every single day. And so in the year and a half that I've been here, I've already seen us move very quickly to deploy new solutions. So like I said, we think we've cracked the code on physician level quality. There'll be lots of innovation happening there. We're developing the ability to create a network out of the high quality doctors. They'll still be in the health plans contracted networks, but we'll be able to identify subsets of those who are really the most high performing. Probably going to throw some rocks in that pond, so watch this space a little bit.
All right.
And I've also seen us be able to listen to our patients and respond really, really quickly. So we had patients who said, I love your service, but I just have a question. I don't want you to schedule me an appointment with somebody.
Sure.
I don't want you to collect my medical records. I just want to ask one of your staff physicians a question.
Okay.
And so we deployed in almost no time flat video and chat capabilities so that folks can just have a quick orientation about a medical term they don't understand, a beginning understanding of what they're going to be in for during their patient journey. We also heard from folks that they might want to start with us on the phone, but then they just prefer to get updates on the mobile app or on the web. And so we're able to have the entire experience in all three of those channels. So I think you're going to see network development, certainly the physician level quality, and a lot of patient-oriented innovation is going to come from us too.
So Ed, in your background, I know that you've been through many different areas of the insurance, the payer industry and the health industry. So I know that you're enjoying being in this phase right now, being part of that startup mentality and being able to be agile and execute so quickly.
Yeah, absolutely. And it's great fun to be in a really patient-focused environment too, that we hear what our patients need and we're able to react so quickly, the fastest of any industry that I've been in, to really meet those needs.
Well, I know that that's been a resounding theme of so many of the interviews we have had today is, listening to the consumer, be it the member, the patient, and really beginning to act holistically and trying to weave that insight back into the enterprise. So kudos to you and GrandRounds for doing a wonderful job. And thank you for joining us here at the Guidewell Connect Insights Lounge.
Great.
This is Kate Warnock. We're going to be up soon with another interview. Please keep watching.